Blurry vision while reading after 70 could be an eye stroke on the why as people age. Changes in vision are common and often expected. After the age of 70, many individuals experience difficulty seeing clearly up close, particularly while reading. This is typically attributed to a condition called presbyopia, where the eye gradually loses its ability to focus on nearby objects due to stiffening of the lens. Other age-related eye conditions such as cataracts, glaucoma, and macular degeneration can also contribute to blurry or distorted vision over time. Cataracts cause clouding of the lens, leading to dull or hazy vision. Glaucoma, often associated with increased pressure inside the eye, can damage the optic nerve and lead to peripheral vision loss. Age-related macular degeneration, or AMD, affects the central part of the retina and leads to a gradual decline in central vision, making tasks like reading or recognizing faces more difficult. While these conditions typically develop slowly and are part of the natural aging process, sudden or noticeable changes in vision, especially blurriness that occurs quickly or affects one eye, can indicate a more serious issue. One condition that often goes unrecognized is an eye stroke, also known as central retinal artery occlusion or central retinal vein occlusion. Unlike gradual vision changes, an eye stroke results from a sudden blockage in the blood vessels of the retina, leading to a rapid loss of vision. Blurry vision while reading may be dismissed as a need for new glasses or better lighting, but in some cases, it could be an early sign of restricted blood flow in the eye. This is particularly important to consider in older adults who may already have underlying conditions such as high blood pressure, diabetes, or cardiovascular disease, all of which increase the risk of vascular complications, including those affecting the eyes. Recognizing the difference between normal vision changes and potential warning signs of a more serious problem is crucial. While presbyopia and cataracts are gradual and usually manageable, sudden vision issues may signal an urgent need for medical evaluation. In the following sections, we will explore what an eye stroke is, how it happens, and why early detection is essential to prevent permanent vision loss. An eye stroke, medically referred to as either central retinal artery occlusion or central retinal vein occlusion, is a serious condition that occurs when the blood flow to or from the retina becomes blocked. The retina is the light-sensitive tissue at the back of the eye responsible for converting visual information into signals that the brain can interpret. Just like the brain requires a continuous supply of oxygen-rich blood, so does the retina. When that supply is interrupted, retinal cells begin to die within minutes to hours. There are two main types of eye strokes. The first is central retinal artery occlusion, or CRAO. This occurs when the main artery supplying blood to the retina becomes blocked, often by a clot or embolus. CRAO is often considered the ocular equivalent of a brain stroke. The second type is central retinal vein occlusion, or CRVO, which involves blockage of the vein responsible for draining blood away from the retina. While both types can cause sudden vision loss, CRVO tends to develop more gradually than CRAO, but can still have long-term consequences that in both conditions. The blockage leads to increased pressure and swelling in the retina. This can result in a range of symptoms, the most common being sudden blurriness or vision loss, usually in just one eye. In some cases, people report seeing shadows, dark spots, or a sudden loss of part of their visual field. These symptoms can occur without any pain, making them easier to ignore or misinterpret as something less serious. Importantly, an eye stroke can happen with no prior warning. A person might be reading and suddenly notice that part of the page appears blurred or that letters seem to be missing. Unlike age-related changes, which are gradual and typically affect both eyes, an eye stroke is usually abrupt and affects one eye significantly more than the other. The underlying causes of an eye stroke are primarily vascular. High blood pressure, atherosclerosis, diabetes, and heart disease are all major contributors. These conditions can cause the blood vessels to become narrow, damaged, or prone to clotting. In many cases, the same risk factors that contribute to brain strokes and heart attacks also increase the likelihood of an eye stroke. It is also worth noting that an eye stroke can sometimes be a warning sign of a more serious systemic vascular problem. Studies have shown that patients who experience retinal artery occlusion are at increased risk of having a stroke or heart attack in the days or weeks following the event. This connection underscores the importance of treating sudden vision changes as a potential emergency rather than waiting for symptoms to resolve on their own. Understanding how an eye stroke occurs and recognizing its early signs can be critical in preventing permanent damage. In the next section, we will examine the key risk factors and warning signs that may help individuals identify the problem early and seek prompt medical attention. Several risk factors significantly increase the likelihood of experiencing an eye stroke, particularly in older adults. The most prominent of these include hypertension, diabetes, high cholesterol, and cardiovascular disease. These conditions contribute to damage in the blood vessels over time, making them more prone to blockages or leaks that can interrupt the retina's blood supply. Smoking is another major contributor, as it accelerates vascular damage and increases blood clotting tendencies. Age is itself a risk factor. After age 70, the cumulative effect of vascular aging makes individuals more susceptible to circulatory problems, including those affecting the eyes. A history of stroke, transient ischemic attacks, or heart attack also increases the risk. In some cases, an eye stroke may be the first indication of a larger, undiagnosed cardiovascular problem. It is important to be aware of specific warning signs that may precede or accompany an eye stroke. One of the most common early indicators is the sudden appearance of blurry or dimmed vision, particularly when focusing on text or fine details during activities like reading. Unlike gradual changes in vision due to presbyopia or cataracts, this blurriness tends to come on quickly and often affects just one eye. Other warning signs may include a dark spot or shadow in the center or periphery of vision, a sudden loss of contrast sensitivity, or a graying or whitening of vision. Some people report that colors appear faded or that they experience a curtain-like effect, where a portion of the visual field becomes obscured. In the case of a retinal vein occlusion, vision may fluctuate over hours or days and may be accompanied by subtle eye discomfort or pressure, though most cases remain painless. Because many of these symptoms are subtle or painless, they're often overlooked or attributed to fatigue, dry eyes, or needing a stronger eyeglass prescription. This can delay treatment and lead to irreversible damage to the retinal tissue. Early recognition is vital. Once blood flow to the retina is interrupted, retinal cells begin to die, and the window for preventing permanent vision loss is extremely narrow, often within a few hours. Certain visual symptoms should always prompt urgent evaluation by a medical professional, especially in older adults. These include sudden blurry vision in one eye, partial or complete vision loss, vision that appears distorted or warped, and loss of visual field. It is also important to monitor for systemic symptoms that may signal broader vascular problems, such as dizziness, facial numbness, or difficulty speaking. Recognizing these red flags and understanding who is most at risk can help individuals act quickly when something is wrong. In the next section, we will discuss what steps to take if an eye stroke is suspected and how it is diagnosed and treated in clinical settings. That if an eye stroke is suspected, immediate medical attention is critical. Just like a stroke in the brain, the sooner treatment is initiated, the better the chances of preserving vision. Eye strokes are considered medical emergencies. Delaying treatment by even a few hours can result in irreversible damage to the retina and permanent vision loss. The first step in evaluation typically involves a visit to an ophthalmologist or an emergency department. A comprehensive eye examination will be conducted, including visual acuity tests to assess how well each eye can see. One of the key diagnostic tools is a fundoscopic exam, which allows doctors to look directly at the retina. In cases of central retinal artery occlusion, the retina may appear pale with a cherry red spot in the center, while retinal vein occlusion may show swelling, hemorrhages, or engorged veins. Additional imaging techniques, such as optical coherence tomography, or OCT, are often used to detect retinal swelling or damage. Fluorescein angiography may be used to track blood flow through the retinal vessels. In some cases, ultrasound of the eye or blood tests may also be ordered to evaluate clotting disorders or underlying systemic disease. Because eye strokes are often linked to cardiovascular risk, Patients may also be referred for brain imaging, carotid artery ultrasounds, and heart evaluations. Treatment options vary depending on the type and severity of the eye stroke. For central retinal artery occlusion, some emergency interventions include ocular massage to dislodge the clot, medications to lower intraocular pressure, and breathing into a paper bag to increase carbon dioxide levels and dilate blood vessels. However, these methods are only effective within the first few hours and often have limited success. In selected cases, clot-dissolving drugs like tissue plasminogen activator, or TPA, may be considered, although their use in eye strokes is still being studied and must be carefully managed due to bleeding risks. For retinal vein occlusion, the focus is typically on reducing swelling and preventing further vascular damage. This may involve intravitreal injections of anti-VEGF drugs to reduce fluid buildup, laser therapy to manage retinal bleeding or abnormal blood vessel growth, and managing the underlying systemic conditions like hypertension or diabetes. Regardless of the specific treatment, follow-up care is essential. Patients who experience an eye stroke are at increased risk for future vascular events, including strokes in the brain or additional eye complications. A coordinated approach involving primary care physicians, cardiologists, and ophthalmologists is often necessary to manage both the acute event and long-term health that I in the next section. We will explore practical steps that older adults can take to reduce their risk of eye strokes and maintain long-term vision health through preventive care and lifestyle changes. Preventing an eye stroke involves addressing the underlying risk factors that compromise vascular health. The same lifestyle choices and medical management strategies that reduce the risk of heart disease and brain strokes also play a key role in protecting the eyes. For individuals over the age of 70, preventive care becomes especially important as the cumulative effects of aging blood vessels and chronic health conditions make the eyes more vulnerable to circulatory problems. One of the most effective ways to lower the risk of an eye stroke is maintaining healthy blood pressure. High blood pressure can damage the delicate blood vessels in the retina, making them more susceptible to blockage or leakage. Regular monitoring and adherence to prescribed medications can help keep blood pressure in a safe range. The same applies to blood sugar control in people with diabetes, as elevated glucose levels can weaken blood vessels and contribute to retinal complications. Cholesterol management is another key factor. High levels of low-density lipoprotein, or LDL cholesterol, can lead to plaque buildup in the arteries, which increases the risk of clots that could travel to the eye. A heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce cholesterol levels and support overall vascular function. Smoking cessation is critical. Smoking accelerates the narrowing and hardening of blood vessels and increases the likelihood of clot formation. Even in older adults, quitting smoking can lead to measurable improvements in circulation and eye health over time. Regular physical activity also plays an important role. Moderate exercise, such as walking, swimming, or cycling, helps improve cardiovascular health, regulates blood sugar, and supports healthy blood pressure levels. Just 30 minutes a day of activity can make a significant difference in reducing vascular risk. Equally important is routine eye care. Older adults should have a comprehensive eye exam at least once a year. These exams can detect early signs of retinal disease, monitor for glaucoma and macular degeneration, and identify subtle changes in vision that may indicate more serious problems. Early detection allows for timely intervention and may prevent more severe complications. That a balanced diet that includes omega-3 fatty acids, antioxidants like vitamin C and E, and nutrients such as lutein and zeaxanthin may also support retinal health. These nutrients are found in leafy green vegetables, fatty fish, nuts, and colorful fruits. Finally, it is important to recognize that not all blurry vision is harmless. While many age-related changes are benign and correctable with glasses or surgery, sudden or unexplained vision changes, especially in one eye, require urgent evaluation. Knowing the warning signs, managing chronic health conditions, and maintaining a healthy lifestyle can significantly lower the risk of experiencing an eye stroke and help preserve vision well into later life.